The next question is slightly touching on a little of what we've just covered there, but I think just to give it some context, I think what I'd like to get out of this is to perhaps understand a bit more about how these investments can be delivered, because we're in a situation now with slowing economies. There's a rising cost of capital and competition, which we're all going through at the moment, specifically across ASEAN in terms of the cost of capital repayments and so on. So the challenge is increasingly to find and fund the investment opportunities. Now, my current role, I support Asia Pacific for the World Association of Investment Promotion Agencies, so our job is really to support and collaborate with IPAs and to support them in terms of building capacity. But one of the things that we're really quite passionate about is building that collaboration between the public and private sector to deliver these investment opportunities. So perhaps it might be good if we could get some perspective both from the government sector and from the private sector about what models have worked well for you, where there's been successes, for example, with setting up factories in Myanmar or other countries in ASEAN, where you've had successful relationships with the government, and perhaps again, and also from the government side, how those relationships have been nurtured. I really think that this sort of area of collaboration, particularly around healthcare, is quite critical for our population. So, Mr. Thant, if we could start with you on your perspective from Myanmar.
Okay, thank you, Andrew, for second floor. So the access to finance is very important in the healthcare sectors, especially in Myanmar. So our government budget allocates, so I want to point it out the data. In Myanmar, government expenditure on healthcare in 2016 was 6% of the total budget. One of the first initiatives, Myanmar increased the public expenditure to healthcare service allocation up to 30% in 2017. Now, our annual growth rate of the healthcare expenditure is reached to 8.5%, and it's expected to elaborate the 60% in the 2030. But the access to finance is not enough for the healthcare sector in Myanmar because, as I mentioned earlier, our hard infrastructure and soft infrastructures are a little bit low than other countries. So that the investment opportunities is very important for healthcare sectors. So that our Myanmar Investment Commission, the prioritize for the healthcare sectors. So healthcare, if you want to invest in healthcare sector, you can get many incentives according to Myanmar investment law. So as I mentioned earlier, every sector, hard or soft infrastructure, you can invest in there. That's why we welcome to private sector for invest in Myanmar to invest in medical clinic and the pharmaceutical factories and other human resources and everything. So I thank you for the Indonesian investor. Indonesia is the top healthcare investment sector in Myanmar. Thank you.